Hey everyone, welcome and welcome back to my YouTube channel. I'm Dr. Jenny Liu, a board-certified dermatologist. And if you struggle with hair loss, you're not alone. This is by far one of the most common concerns I get in my practice on a regular basis. And there's so much misinformation out there. So today, I really want to talk about some of the common misconceptions around hair loss and discuss what actually works and taking a deeper dive into how red light therapy can be helpful for regrowth. Now, full disclosure, I do want to thank CurrentBody for sponsoring a part of this video, but I also want to share the objective research, science, and clinical data on the efficacy of LED therapy and why I'm a believer and why I use an LED device on a regular basis for healthy hair to support my hair growth and why I use it aggressively postpartum twice now to help with my postpartum hair thinning. Without further ado, let's get into the myths. Myth number one is biotin supplements can help with hair loss. And you probably have seen a lot of dermatologists actually now saying biotin doesn't help. And even when I was in residency over 12 years ago, it was something that we actually recommended regularly. But science is always evolving. And what we know now is that biotin probably doesn't play a strong role in helping with hair regrowth. That is because number one, many of us are not biotin deficient unless you are very malnourished, you have a very strict diet. So first of all, it's really hard to be deficient in biotin. And more importantly, biotin supplements or taking excessive amount of biotin could lead to potential false elevations in your labs. Specifically, if you have thyroid disease and take thyroid hormone replacement, it may mess up with your thyroid labs. It can also mess with your cardiac labs, and specifically around people that get cardiac enzyme checked to rule out certain heart conditions or heart attacks. And even more scary, it can also falsify certain pregnancy tests. And so this is where the risk overall of taking biotin is probably very low, like very low harm in taking biotin. But more importantly, it doesn't really do much for hair growth. And if you are someone that does struggle with thyroid disease and heart problems, you just need to be aware if you do take biotin supplements that your labs may be abnormal, or notify your provider that you are on a supplement. So if the labs do come back unexpected or abnormal, you can discuss with your provider the significance of the lab results. Now, having said that, there are a few vitamin supplements that I recommend to my patients if they ask me for recommendations that can potentially support their hair regrowth journey. And that's Nutrafol and the Viscal. And both of those do contain biotin, but it's not the biotin that's actually helping. It's their proprietary blend of active ingredients that is supporting that hair regrowth. When it comes to nutrition and vitamin deficiency, what is relevant is vitamin D. Significant vitamin D deficiency can actually lead to telogen effluvium. In fact, in my practice where I have a ton of skin and color, I've caught so many vitamin D deficiencies. Also, iron and zinc. Zinc is usually more prevalent in elderly patients. So if you are young and healthy and eat a well-balanced diet or take a multivitamin, you're most likely not zinc deficient. Iron can play a role, especially for those who are older, but also who have chronic disease, and for women of childbearing age and have heavy menstrual periods. So those are the labs that I really check. But when it comes to regular supplementation that can make a difference for healthy hair or supporting your hair growth journey, I would say vitamin D is probably the most single-handedly most important thing that you can take, and you should be taking on a regular basis. Not just for your hair health, but for your bone health, as well as vitamin D, we also know has immunomodulating properties, meaning it helps to support your immune system overall as well. So bottom line, do not rely on biotin as a magic fix for your hair loss. And I would even extend that, do not rely solely on supplements alone to help with regrowth. Myth number two, washing hair too often leads to hair loss. This is so false. In fact, if you don't wash your hair because you are fearful, because I get it, you see hair coming out when you're washing it, but if you actually don't wash your hair, you actually contribute more to hair loss. Because when you don't wash your hair, sebum builds up that contributes to oxidative stress. UV can cause the sebum to oxidize. The sebum is also food for malassezia. Sebum, malassezia, and UV exposure are probably the top three risk factors, or I would say that contributors of oxidative stress. And when it comes to hair loss, oxidative stress is the biggest enemy, aside from some other maybe genetic predisposition hormones that actually can lead to more hair loss. And also, If you want to grow hair, you cannot have excessive oxidative stress on your scalp. You're not going to grow hair very well. And even if you do grow hair, we know, like from dandruff, psoriasis, that oxidative stress contributes to unhealthy hair that's more likely to be dry, brittle, and break more easily. Now, understand that it is very normal for us to lose anywhere between 50 to even 150 strands of hair a day. Some of those are just, they fall out regularly, when you brush your hair, when you touch your hair. But one of the most common times we see hair coming out of our scalp is when we are washing, because we are manipulating our scalp, we're massaging our scalp with a shampoo. So what you're seeing that's coming out is not because of hair washing, but merely the fact that the hair has separated from the roots from your scalp, and sometimes it's just stuck in the tresses in your hair, and you're just loosening that up with the process of hair washing, and therefore you see it coming out when you are physically washing your hair. So what you want to do if you are struggling with hair loss is you want to wash your hair regularly. How often really depends on your hair type, your scalp type, but I would say on average, most people wash every other day, 2 to 3 times a week. If you have dandruff, that is another contributor of oxidative stress, one of the major contribution of oxidative stress. So you definitely want to make sure you're using anti-dandruff shampoo that contains like zinc pyrithione, psyllium sulfide, Nizoral, for example, like Vichy. I've talked about their products before, Dercos from Vichy, even CeraVe anti-dandruff shampoo, or Head and Shoulders. But you want to use that regularly to help with reducing dandruff and that inflammation that contributes to oxidative stress. So if you have oily scalp, it is totally okay to wash your hair on a daily basis if you need. And even if you don't struggle with dandruff, incorporating an anti-dandruff shampoo is the best thing you can do to support healthy hair environment. In fact, studies have shown that anti-dandruff shampoos alone, whether you have dandruff or not, can support hair regrowth, namely zinc pyrithione and ketoconazole. So bottom line, wash your hair when you need to. Hair washing does not contribute to more hair loss. Hair washing helps with keeping your scalp healthy, which is the foundation for growing hair. Myth number 3 is wearing hats causes baldness. And this is something I actually get asked all the time by my patients, and it's really not true. There's a lot of things that happens with hair loss. Hair loss is actually quite complex. Growing hair is very metabolically demanding. And so often when an individual is experiencing hair loss, there's probably more than one factor at play. And we do know genetics, hormones, lifestyles, certain stressors, medical conditions, all of that can contribute. So wearing hats itself is not going to cause baldness. Now, one thing to keep in mind is that if you do wear hats and there is a lot of friction, if the hat is tight, sometimes that rubbing or pressure can lead to breakage of your hair more likely than true hair thinning. And that breakage with the shorter hair fiber can make it appear like you are thinning in a particular area. And so that usually is the case if you do wear hats a lot, is that it may just cause your hair to sit in a different way, in a different position, or say cause more hair breakage that may give off the appearance of like hair thinning. Now, hats, I'm a big proponent of wearing hats, especially in the summertime, to protect your scalp. Many of us are not in the habit of wearing scalp sunscreen. It might not be the most elegant, may lead to more greasiness. So wearing hats is one of the best ways you can protect your scalp from UV damage. And in fact, UV radiation long-term is the #1 contributor to hair thinning as we age. It can also contribute just naturally to hair thinning, to possibly graying of your hair, as well as damaging your hair health overall. And if you color treat your hair like me, like even UV exposure on your hair can accelerate that color breakdown. So it's really important to protect our scalp and hair. And hat, I feel like, is one of the easiest ways to do that. And so I definitely encourage you wearing a hat on a regular basis, especially if you're going to be outside in the summertime. Just make sure that it is something that's wide brim, not super tight. And if you do wear caps or hats regularly, taking breaks can be helpful. And just make sure that you're not, it's not rubbing on your hair a lot that could potentially lead to breakage. So bottom line, baseball caps is probably unlikely, very unlikely to be the cause of your hair loss. Instead, other things like hormones, genetics, scalp health, and stress, those are more likely to be contributors. And hair loss is complicated and often it is multifactorial. Okay, so now that we've talked about the common myths around hair loss, let's actually talk about what can be helpful. And one type of treatment that is very trending but actually has quite a bit of science and research behind it is red light therapy. Red light therapy is also known as low-level laser therapy, so LLLT, and it's one of the most promising non-invasive treatments to help support hair regrowth. And this is why I love it, because not only is it safe, it can be used by pretty much everyone, regardless of your age, the type of hair loss you have, and also what other treatments you're doing, whether it's over the counter or prescription. It really is a great complement to your hair growth journey, period. And even if you are expecting or postpartum, it is one of the safer things you can do because it's something that you put on your scalp, and you don't have to worry about potentially affecting your growing baby or your breast milk. So how LED light works for supporting hair growth is through a process called photobiomodulation. So that light energy is absorbed into your hair follicles, into the cells, by the mitochondria specifically, and that is converted into energy to help stimulate hair follicle growth, to increase blood circulation, reduce inflammation, and prolong hair growth cycle. In fact, LED therapy has been shown to improve hair density, hair thickness, and even hair quality. Obviously, it's mostly studied in the context of androgenetic hair loss, so female and male pattern hair loss, but those are the most common types of hair loss. I also recommend it to my patients that have like stress-related hair loss, like telogen effluvium postpartum, and that is the reason why I used it twice for my postpartum hair thinning. As long as you don't have scarring hair loss like folliculitis decalvans, lichen planopilaris, because those are true medical conditions of your scalp that really needs to be treated, addressed by a dermatologist. The most common types of non-scarring hair loss, which are the most common types of hair loss in general, so androgenetic hair loss and telogen effluvium, this LED therapy can be very helpful, and it can be used alone, or even better yet, in combination with your other treatments to really support and improve your hair regrowth. So when it comes to LED helmets, I do recommend the CurrentBody LED hair regrowth helmet because it is backed by clinical trials and science. So first of all, it is FDA cleared, which means it's passed a safety test to be used at home. It can be used alone, like I said, or to complement your current hair regrowth treatment. And it contains 122 red light LEDs to penetrate the scalp to stimulate hair follicles, encouraging thicker and healthier hair. Clinical trials have shown that 100% of the users experience hair regrowth with an average 33% increase in hair density over 6 months. Now, certainly there's no shortage of LED devices for hair regrowth on the market, but they're not all created equal. Aside from the number of bulbs, the energy that is delivered also matters. And what sets CurrentBody apart is the energy that it delivers. It delivers 3 times more powerful light energy than some of the competitors. So it actually delivers 18 joules per centimeter squared of red light energy, while some competitors may also deliver 6 joules per centimeter squared. And for me personally, I love that it's a helmet that provides adequate coverage for my entire scalp. So you know that all the hair follicles on your scalp are being treated with equal amount of energy. Unlike some of the handheld devices where you kind of have to move around, you may potentially have mid spots. It's also really lightweight, and all it requires is just 10 minutes 3 times a week, making it really easy to use. So often what I'll do is I'll put it on at night while I'm watching TV, scrolling my phone, or even midday if I have the time while I'm finishing up emails and doing some work on my computer. So if you are experiencing hair loss and is looking for an LED device to help with your hair regrowth journey, this is definitely one I recommend because number one, it's clinically proven, FDA cleared, has full scalp coverage for even stimulation, and it's more powerful than other at-home LLLT devices. It's convenient and only requires 10 minutes per session and only have to use it for 3 times a week. Now, if you do use a device like CurrentBody, just make sure that you give yourself ample time with any hair loss treatments at home, whether it's topical or devices, or even things that you take orally, prescription or supplements. You really want to make sure you give it at least 6 months, sometimes even longer, before assessing the results. Now, aside from LED therapy, what other treatments can you do? Honestly, when it comes to hair regrowth, the more you do, the better it will be. So let's talk about some of the options. Now, certainly if you are like expecting or say postpartum and you have postpartum hair thinning, you're nursing and you really are limited with what you can take and what you can put on your scalp, the LED therapy helmets like from CurrentBody is really one that you can use safely with low risk. But say if you're an average individual experiencing stress-related hair loss or have androgenetic hair loss, what else can you do? Well, if you can't see a dermatologist, you can easily get topical minoxidil. This is the best studied topical treatment without a prescription that can help with pretty much all types of hair loss, but predominantly androgenetic hair loss and telogen effluvium. And this is where I just recommend, regardless of your gender, get 5%, the cheapest 5%. And disregard what the box says. The cheapest 5% is safe for all genders. And I recommend the foam because it's just easier to use, less likely to drip and cause undesired side effects. It's also less irritating on your scalp, but it can be a little more greasy. The vehicle, whether solution or foam, is more personal, but you just make sure you get the 5%. You can use it once or twice a day on where you're thinning or all over if you need it. Make sure you wash your hands. Make sure your pets are not licking your scalp or licking your hands, because it could be potentially toxic to cats and dogs. And you want to give it at least 3 to 6 months of consistent use. When it comes to topical minoxidil, and sometimes even oral minoxidil, which is a prescription, some individuals can experience this more aggressive shedding in the beginning. It's actually a sign that it's working, because minoxidil doesn't work in everyone. There's an enzyme that kind of converts minoxidil to the active form, and we have genetic variability on how active that enzyme is. So even though when you do see shedding, which is really devastating and frustrating when you have hair thinning to begin with, it's actually a good sign because it means you're responding, and if you keep using, it will stop. The shedding usually occurs within the first 4 to 6 weeks, and so if you can get past that, then you really will continue to see good regrowth. And then I also mentioned oral minoxidil, which is a prescription. This is definitely much easier to do than the foam, but certainly comes with more side effects. It is a prescription. Common side effects includes undesired hair growth, namely facial hair growth for women, which often can be the limiting factor for how high we can go on the dose. Some people may experience lower leg swelling, maybe a little bit of lightheadedness, dizziness. It may affect your blood pressure. Definitely not recommended if you have heart problems, but this is one certainly it works better than the topical. It can work better than the topical, I should say. Certainly not something that you want to take when you're pregnant and probably nursing, but you can talk with your dermatologist about that as a potential option for you as well. And then continuing down the line, other prescription medications that can be helpful is number 1, FDA approved Finasteride or Propecia, but only for male pattern hair loss. And I really don't prescribe this to women of childbearing age because it is pregnancy category X, meaning it will cause birth defects. Also, the results are better in women who are postmenopausal with androgenetic hair loss. So I use it off-label, and my female patients who are postmenopausal and have like female pattern hair loss. But for men, Propecia or Finasteride is FDA approved and it works really well. There are obviously side effects, including potential decrease in libido, sexual dysfunction, and things like that. But again, this is something you definitely want to talk to your provider about. And certainly the cousin of it, Dutasteride, that is not FDA approved, is used off-label but have lower side effects and can work a little bit better even than Finasteride. Similar side effect profile but lower risk of side effects. And again, similar to women, it's not recommended for women of childbearing age, but postmenopausal women, I actually really love it in that population for my female patients who are postmenopausal and have androgenetic hair loss. Now, for women of childbearing age, if they're not expecting and not planning to get pregnant, aside from oral minoxidil, the other option is oral spironolactone. The acne medicine, for hormonal acne at higher doses, has been shown to help with potentially androgenetic hair loss. We use it more commonly in women that struggle with like androgen syndrome, in the sense like they have hyperandrogen in like namely polycystic ovarian syndrome, where they have polycystic ovarian cysts on their ovaries. They have potentially metabolic syndrome, insulin resistance, hormonal acne, and then hair thinning. And so this is where at high doses it can be helpful, but alone really is not the best treatment. But certainly it is one that has relatively low side effect profile, and something that you can use with other oral medications or even combine with topical minoxidil and LED therapy together as a part of hair regrowth. In fact, a lot of these oral medications, if the side effects are low and you tolerate, you can often combine them together. I actually have a handful of patients that will take oral minoxidil and oral Propecia to help with hair regrowth. So this is where, because it's prescription, it does come with more side effects. So to make sure you talk with your dermatologist so you're aware of all of them and find the best prescription treatment for you. And lastly, don't neglect your scalp health. As I mentioned, your hair grows within your scalp. If your scalp is not healthy, it doesn't matter what you are putting on it, what you're wearing, what helmets you're doing, even oral things, you're not going to maximize hair regrowth. And so this is where taking care of your scalp is super important. And when I say taking care of your scalp, it's not fancy. It's just washing your hair when you need to and don't let it get too greasy. And similarly, don't get a lot of sun on your scalp. Protect your scalp from UV damage. Wearing hats, scalp sunscreen, the two most biggest contributors to causing your scalp to get damaged that will lead to hair thinning, whether it's age-related or contribute to your pre-existing and genetic hair loss or telogen effluvium. So with that, shampoos, I mentioned earlier, an anti-dandruff shampoo. If you have dandruff, you definitely want to use it more often, maybe 2 to 3 times a week. But if you don't have dandruff, you can just use one maybe once a week to keep your scalp healthy. So ones I recommend, I prescribe prescription ketoconazole 2% to my patients, but 1% nizoral is great. That can be drying on hair. So you can also look for like a zinc P from CeraVe, Head and Shoulders, or even Durkos. I really like that with selenium sulfide that helps with dandruff as well. Those are great and they're very gentle on hair. Another shampoo I really love is from Nioxin, their hair fall defense shampoo, and I actually use that once a week for me. I really incorporated that postpartum second time around. It really made a difference for me. And when I do recommend Nioxin to my patients, the feedback I get from my patients, they really love the way their hair feels, more volume, just feeling fuller, and does support healthy scalp environment and stimulating and supporting your hair regrowth. So certainly those are shampoos that I recommend. And then, topical serum is one of those things where I think certainly go for it if it's a part of your routine and doesn't cause irritation. I think caffeine has a lot of data. There's one from Nioxin that is hair fall defense serum. The Inky List also has a caffeine serum that could potentially support hair regrowth, but really topically, I think the best thing you can do is try minoxidil. So that would be the one that I recommend starting first if you're going to do anything, and then obviously incorporating one of those shampoos or even rotating between them on a regular basis to really support scalp health. Alright guys, lastly, I just want you to remember hair loss is super complex. If you do give everything I mentioned a try, 6 months later, you're still experiencing a lot of hair loss or just not having the results that you want, please see a dermatologist. Hair loss is often multifactorial. There may be things that are not being diagnosed or addressed appropriately. Furthermore, if you are experiencing significant itching, redness, flaking, or even scarring of your scalp, this is where you definitely need to see a dermatologist. Those are red flags, potentially suggesting scarring hair loss that could be permanent, and early treatment, early intervention is really key at preventing permanent hair loss. So please follow up with a dermatologist. But otherwise, if you're looking for a non-invasive at-home treatment, red light therapy like the one from CurrentBody LED hair regrowth helmet that is FDA cleared and clinically proven to support hair growth at home, that can be a great option for you to use alone, or better yet, incorporate that as a part of your hair regrowth journey. And then there is also a discount code that you can use if you are interested in purchasing the product. I'll make sure to put it on the screen right here. Thank you guys so much for watching. Let me know if you have any questions below. Please give this video a thumbs up and don't forget to subscribe to my channel, and I will see you guys next time.